My name's Amber Fox. I have my list of terms here, as well as some unlabeled diagrams. This is my skeleton, as well as my skull. Axial skeleton, frontal bone, nasal, maxilla, mandible, zygomatic, vomer, lacrimal, ethmoid, sphenoid. Here we have parietal, occipital, mandible, and temporal here. And then we have frontal, parietal, occipital, temporal, mandible, maxilla, nasal, lacrimal, ethmoid, zygomatic here. This view, occipital, parietal, frontal, temporal, ethmoid, and sphenoid in there. All right, that was the inferior skull. So now the vertebral column. So here's my diagram. So this is divided into 3 sections. The first 7 are known as the cervical. C1 is known as the atlas, C2 is the axis bone, and then C3, C4 all the way to C7. The next 12 are known as the thoracic vertebrae. So you have T1 through T12. The last 5 here are known as the lumbar vertebrae. So you have L1 through L5. Here we have the sacrum, and here we have the coccyx. Also, we have the thoracic cage. Thoracic cage is the body of sternum here. The manubrium of sternum is here. The first 7 ribs are known as the true ribs. 8 through 12 are known as the false ribs. 11 and 12 are known as floating ribs. The appendicular skeleton consists of the clavicle here, the scapula here. We have the humerus bone, the radius bone, the ulna bone. Let me bring this a little bit closer. The wrist bones consist of triquetrum here, pisiform here. We have capitate, we have hamate, and lunate. And then here we have the scaphoid. We have the trapezium here and the trapezoid. We also have the sesamoid bone here. These are the metacarpals, and then these are the phalanges. We have the ilium here, the ischium here, pubic bone here. This is the femur. This is the tibia, and this bone here is known as the fibula. Here we have the calcaneus, which is the heel of the foot. Here we have the cuboid bone, and then we have the lateral cuneiform, intermediate cuneiform, and medial cuneiform. Here we have the talus and navicular here. These are the metatarsals and the phalanges here. One of the bones of the, one of the diseases of the bones is osteoporosis. And what that is because our body, the bones support our body, and the bones are consist of calcium, 99% calcium, magnesium, and phosphorus. And so there's an overactivity of the osteoclasts, which are responsible for breaking down of old or damaged cells in the bones. And so the structural changes are loss of bone mass as well as deterioration of bone tissue. And the functional changes are increased risk for fractures. And typically we see that in hip fractures as well as spinal fractures. Thank you.